Dr. Perry, welcome to the show. To say that it is an honor to have you here is an understatement. I am so excited. How are you?
I'm super excited too. Thank you so much for asking me. I'm grateful, I'm honored, and I really appreciate being here.
Oh, well, the pleasure is mine. As we were just chatting about off air, I've been, I guess for lack of terminology or better terminology, I've been a real fan of your work and Stop Chasing Pain and just everything that you are doing and have to offer people who are listening and watching and all the things. And so it's amazing and humbling to be sitting across from you and to be able to bring your wisdom and intelligence to the listeners. I literally cannot wait to have this conversation. I'm so overjoyed. So the pleasure is really mine.
Oh man, well, thank you so much for following my work, by the way. I mean, that's probably the one of the kindest things that you could say. I definitely love sharing it, so I'm excited for your watchers and your listeners to learn a lot about the lymphatic system today and their overall health. It's going to be fun.
It's going to be awesome. And, you know, it's interesting because I'm going to ask for your backstory because I feel like it is important for people to know why you're doing what you're doing. But
Mhm.
just off the bat, it's like, the lymphatic system and lymphatic work is gaining steam, but it's still a lot of times overlooked, and not just in the conventional space, but also in the quote unquote alternative space or the holistic space. It seems like sometimes it's just not like a prominent area or system that practitioners are focused on when treating patients. So that's just a huge thing. And I feel like you're going to definitely have some influence, I think, here because my goodness, as I was telling you, it's been a huge game changer for me personally. So before we get into all the lymph
Mhm.
work, why don't you give us a little bit of a backstory on you and why you're doing what you're doing?
Thank you very much. Well, my purpose in life right now is to change that, to try to get every single person to at least hear about the lymphatic system and why it matters. And I personally think that it's going to be involved in some way, shape, or form in every type of uh, inflammatory condition that people have, autoimmune disease, chronic pain. And by the end of the show, too, I think most people will say, yeah, I think you might be onto something, Doc. I agree with you. But not too many people know about lymphatics. More so know about it now than ever before, which I'm really happy to see. But when I started doing it, I mean, virtually people thought I was talking about like aliens and stuff like that. I don't know what lymph, what? But you know what? I can't blame them because I was once in the same position of where I was not even considering lymphatics as any piece of my chronic pain autoimmune issue. And I'm in healthcare. I've been practicing for almost 30 years now, but I never gave the lymphatic system a second look for the first 20 of it. And I probably would have kept going that way too until I hit this thing called rock bottom. I call it the abyss or the quicksand, where you just feel like you're lost because, maybe yesterday you felt great, and then today all of a sudden you can't get out of bed and you have all these different symptoms and pain, and nobody can figure out what's going on, or people can't find anything on a test, even though you feel horrible. I mean, I know there's people shaking their head right now because those are the people that I'm trying to help because that happened to me. It was a slow progression of misery, I call it. Like every day I got a little bit worse, but you kind of get used to it and then you think it's kind of your normal. And then all of a sudden it gets so bad that you have to say to yourself, okay, something's not right here and I need some help. And I needed to do that too. Because here's the thing is that everything I'd learned up to that point to try to help myself wasn't working.
Mm.
And what do I mean by that? I'm doing my movement based things that I've done. I'm doing chiropractic. I'm doing my exercises. I'm doing manual therapy. I'm going to all these things. I even had to have some surgical interventions that at the time were necessary, thinking that they may ultimately have been the cause, but they didn't help. I actually got worse. because you're not fixing the issue. You're chasing what they call downstream problems, right? So I said to myself, okay, well, I'm not figuring this out. Maybe I'll try to find somebody else who can figure it out, because that's what you do.
Mm.
Well, guess what happened? Nobody else could figure it out either. And I got the same thing that a lot of people here are listening is that, you're trying the typical stuff from changing your diet and changing your supplements or doing all these sort of things. Or the best one yet is they say it's all in your head, which they're kind of right, which I'll get into later, right?
Yeah.
And I was really in a bad spot. I kind of gave up, honestly. I got so bad that I just could barely function physically and mentally. Losing my mental faculties scared me the most, and that was because of so much underlying inflammation I had in the body that it made its way to my brain. And so tired and fatigued, couldn't teach anymore, had to stop teaching, couldn't practice anymore, had to close my practice. And I was just kind of wasting. And the universe kind of opened up, and somebody reached out to me who I went to chiropractic school with a long time ago, who had seen that I was struggling. And he said, hey, I know you're struggling. I'm getting into this thing. I'm going to London, and it's like an energy based kind of approach to looking at how the body heals itself. And I'm like, okay, well, hey man, I'm game because nothing else is working. And I went there, and on the very first day, they started thinking to put this thing up, a picture of the lymphatic system. And he said, yeah, most of the people that I see have some type of lymphatic system issue. And I went, lymph what? 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 I mean, I wasn't even looking at that, and nobody else was looking at it either. Right? And I was so bad that they brought me up in front of the class as the model for, checking it out. And that's where I started to learn how to assess the system. And they started pushing on areas where a lot of these lymph nodes, they're called, that some people have heard of those. Those are basically mini body toilets that flush out waste that from now on I'm going to call muck, which just means anything in your body that you don't want there that can kill you or take you out. Every single spot that they touched hurt more than the last. Each one was really puffy and swollen and inflamed. But here's the thing. This is really important. I already knew those areas were puffy and tender and inflamed. Some, but not all, because I wasn't looking in some places. But I never, ever, ever was thinking, I wonder if it's lymphatics underneath where I'm pushing that's causing all this stuff. I was thinking fascia and muscle and all of that. Because here's the thing, they all go together, but I wasn't thinking, what's with this lymph stuff? And my life changed because up to that point, I really suffered. And they went through the assessment, and that night I felt pretty horrific, because when you start to move lymph that's been stuck for a while, you go through this thing called a detox that you need to go through, but it's not fun. But about 2 days later, I was like, wait a minute, I'm feeling like 30% different. Not as tired, as fatigued. And I'm like, I think I'm a little sharper today, And I slept better, and I started to see changes already in some of the puffiness. And that was the initial string that I pulled, where it was attached to everything else that I'm doing the rest of my life from that moment. That was the catalyst. And 30 days after that, after starting to do some work with lymph, I was almost a different person. And then I said to myself, this thing was in front of me the whole time, but I just didn't know it, because you don't know what you don't know. And so now I started to think like this. If I didn't know about this stuff, and what really got me upset too was nobody I'd been to as a healthcare professional said anything about the lymphatic system, and they should have. And I should have known about it, especially if I'm in that world. So that was the moment I said, you know what? I'm going to tell this to everybody, and at least put it on the radar that it might be a piece of their puzzle or a big piece of their puzzle. but nobody was really talking about it. And I couldn't really find a program that someone could get some education on it or even know where to start. So here's what I said. You know what? I'm going to do it myself. So all I did was I created a program called Body Aquarium, Lymphatic MOJO. Body Aquarium is a really key phrase because I'm going to explain it later. And this analogy will explain everything you ever need to know about the lymphatic system. And I put that out there, and I got to tell you what,
Mhm.
that thing went ballistic on people purchasing it. But the only reason they were purchasing it is because it worked. But they started to message me all the time. Doc, this is crazy. This makes so much sense. I feel so much better. I feel so different. And I'm like, yeah, I know, because that's where I was, right? And then that's been my mission to now to come on shows like this, because here's the thing that I also realized. When you get into things, especially in the healthcare field or education, and now you learn it, you make the common mistake of thinking that it's common knowledge and everybody else must know it. And I'm here to tell you that most people do not. And even now, because see, it's like just what you're aware of. You ever notice it when happens? I always use an analogy. When you buy a car and then you drive the car off the lot, you say, okay, why does everybody now have my car?
Yes. Yes.
But it's like all over the place. So that's the way it is when you learn lymph. You start to see it everywhere because you hang out with people that know about lymph, and then you think it's everywhere. But then when you go out in the real world, people are looking at you like I was, like, what is lymph? But the scary part is I see that in the medical community as well.
Yeah.
And that's the one place that you absolutely have to know about the lymphatic system as being linked to not just lymphedema, which we'll talk about in a little bit, but everything else. Now, I know I kind of went long-winded there, but you can see, when I get asked about this, I light up because that was a transformative moment that, one, I say without hesitation, saved my life because I would have been dead, no doubt.
Yeah.
To now being able to use that. And what we talked briefly about before is that there had to be some reason why I fell into the abyss so far and couldn't get out. Like, what's the lesson here? Not necessarily for me, but what do I have to learn now to be able to show to other people? Because until you hit a former rock bottom, and you're forced to think differently. And that's really what happened for me. It wasn't so much about the lymphatics being super powerful. They are, but it's only that way until you learn about the lymphatics. You follow?
I am very much. It's very relatable. It's yeah, there's so much to say, and I'm so excited. I'm just so excited on the other side of this because I'm like shaking my head profusely, right? Because it's relatable, and I feel like a broken record when I say that, pretty much every single guest that has come on this show has a story that has brought them to their work. That
Yep.
they've had this rock bottom story. And I want to revisit just a couple points that you said
Mhm.
where I'm just like, yes, just shaking my head, which is you're so right about getting lost in the fact that we think, and I say this a lot. I've actually said this on my even my social media. We think that just because we know it, everybody knows it. Sometimes I question myself like, "Oh, I'm not going to talk about this because I feel like this is old news for people." People
Yeah.
are not. No, we lose
Oh.
track of the fact that we run in certain circles. And so what is common for, you might not be common for the rest of the world. And so it's so important to sort of like always gain that perspective. It's so crucial and such an important point. And then it's so interesting. I just kind of had like a little silent laugh when you were talking about when you were in that little seminar or conference or whatever that was, and you were brought to be the model.
Hmm.
That happened to me.
Mm.
And it's so funny because this was years ago. I was probably 29 years old, and I'm a licensed esthetician. Actually, I'm not practicing, but I remember there was a week there where we were doing some studying on lymph massage. And I was like,
Mm.
oh, what's this? I've heard about it, but nothing, I don't really know much. Got selected to go up in front of the class. And the professor decided to do a little bit of work on me. And I got through about 20 seconds of that work at the collarbone, which I know we're going to get into.
Oh
And
yeah.
I went into a full on coughing fit where
Mm.
I had to leave and they had to replace me with another model. Looking back at that experience, I knew nothing really of what was going on other than, wow, there was something that was stimulated there. But that just showed me how clogged the pipes were, I think, at the time, because
Yeah.
I clearly was a mess. I mean, I was like, and it was an immediate response, immediate. And so that was really interesting. So I just had to throw that in. But it's so true. You're talking about how we mentioned it earlier, how it's so overlooked. It is so absolutely overlooked in the medical community, which I think is, part of why you're so passionate about it, but also kind of makes you a little frustrated and angry, because I feel like it's such a crucial part of, and it plays
Mm.
such a role when we're talking about all the other systems, because as you always say, nothing is isolated, everything works together. So
That's
let's go
right.
through, yep, let's go through some
Right.
basics. I want you to, first of all, just for people who might not even be familiar with
Mm.
they know lymph or lymph nodes, but they don't really know what the system does. So let's go into, what is the lymphatic system? How does it relate or connect or work with other systems in the body,
Mm.
etc.?
Great question. So what I'm going to do is I'm going to tie the lymphatic system along the way to all of the other systems in the body because, as you said before, and what I teach all the time is there's no such thing as isolation in the human body. And the same thing applies for lymphatic issues. It's the whole thing or nothing, in my opinion. So let's start with the two primary systems that the lymphatic system is part of. One, it's the primary component of your immune system. And that's kind of a big deal because that system keeps you from being dead, right? And that kicks into gear when it's trying to protect you from, illnesses, things like that. But anything that makes its way inside of the body or is even already inside there, like uh, bacteria, viruses, parasites, toxins, anything that gets inside, okay, even cancer cells that are inside of you. The lymphatic system, its job is to find it, trap it, scan it, kill it, get rid of it. That's its thing. And if the system works well and it's not overwhelmed, well, you're going to get sick and you're going to get exposed to those things because that's what happens on this earth. And you get sick, but then the idea is you're not supposed to stay sick. That's the thing. You're supposed to get better, but recover and regenerate and have your immune system actually become stronger and more resilient when it fights something and recovers from it. But unfortunately, we have this thing called chronic pain and chronic disease. That means you don't get over it, right? So then if I hear that, I'm already thinking, well, why? Why can't you get over it? Right? Then in the back of my mind now, I'm thinking lymph is going to be a part of the puzzle. So it gets rid of waste, but it also gets rid of the waste that's naturally inside of you from your own cells dying every day so you can make new ones, right? And you make waste every time you go to the gym and you train and you work out every day you get billions of cells that go bye-bye and they got to get out. And the lymphatic system is a big player in that. Okay. So it gets rid of cellular waste too. So when cells create energy, that's called life. I always tell people in simple terms, cells poop. They make waste. It's cell poop.
Yeah.
And the lymph nodes are the toilets for the cell poop. Okay? So it's not just about trapping toxins from outside, it's from stuff inside, but your own cells dying every day and the ones that get injured in trauma.
Yeah.
So when you bang your knee and you damage things, that stuff needs to get out. But then here's what before I continue, I want to plant this seed. What happens if stuff can't get out? Like what happens if your lymphatic system has been an issue long before you hurt your knee and you didn't know it was an issue before you hurt your knee? Maybe your knee's not going to get better because the stuff can't get out.
Right.
So I'm going to let that sit in the back of your head for a little bit because it's going to make sense later when we cover some of these things, okay? Mm-hmm. These light bulbs are going to start dinging off. So primary component of your immune system, we're going to get into a lot of that later. Yes. But there's another system that's a big part of that many people don't even know about that. It's a primary component of your circulatory system, your vascular system. That is blood flow into something. Those are arteries, arterioles, and capillaries. It's just types of blood. Then you have the vein part, and the veins are where most of the waste stuff lives in your blood system. But the lymphatics will ultimately turn into and dump into the vein system of the body at the neck. So the fluid moves from the lymphatics, and then it eventually goes into the veins. It's the same fluid, even though it's called a different name and it's a different pipe, but it's the same stuff. You follow? There's a different consistency to it, okay? But what I want you to understand is all this stuff loopy-doops together. It does not separate anywhere. So when you have muck stuck in your lymph, guess what? You got muck stuck in your blood too. And that is not going to work out well for you for healing and recovery and regeneration. So what I tell people is, if you have a lymphatic system issue, you have a blood flow issue. If a blood flow issue, you have a lymphatic system issue. So they always go together. So when this system gets overwhelmed and doesn't work as well as it could by sheer neglect, quite honestly, because you're not doing anything on purpose and intention to take care of it. It's like your teeth. If you didn't do something with your teeth every day, you wouldn't have any teeth. It's the same thing with your lymphatics. You need to do something intentionally on purpose every day. So my big six that we'll talk about later, to me, that's your brush and floss for your lymphatics every single day. Yeah. So when you get that system working, you will, one, have a more optimally functioning immune system to help you heal, recover, and regenerate and not stay in inflammation, because its job is to control inflammation. And if you have autoimmune disease, you have inflammation. If you have chronic pain, you have inflammation. And it's a major player in balancing your circulatory system. So I would say those are pretty important components, right, of the lymphatic system. What I want people to understand is there's much more to the lymphatic system than just having a swollen part of the body from what they call lymphedema. Most people will look at lymphatics when they have lymphedema. That means you've actually progressed to physically damage the valves in these pipes that the lymph flows in. And so they can't pump the fluids or move the fluids efficiently because the valves are damaged, and then the fluid just stays there. And then people say, you've got a lymph problem. Right? What I'm going to tell you is you're going to have a lymph problem even though everything looks great, because you can still be stagnant underneath, but you don't manifest the symptoms of lymphedema. You manifest the symptoms as all these different diagnoses that somebody throws at you.
Mm.
Okay, that's what they're also discovering when they look at lymphatics, is that it's a major player in a lot of these what they call comorbidities. It is linked uh, highly to Crohn's disease these days. Glaucoma in there is a big one. They're also looking at it in relationship to brain and neuroinflammation in relationship to Alzheimer's, MS, and Parkinson's. And that's going to make a whole heap of common sense when I tell you how lymph drains from the head and neck.
Yep, yep, yep. You took when you said Parkinson's and dementia and Alzheimer's, that's exactly what I was thinking because I feel like if memory serves me, I don't know. I feel like I'm like a hidden student of your work over here, but I want to
Yeah.
say that you have said that, and again, we're going to get into this, about a third of our lymph is above the shoulders or above the collarbone. Is that
Yeah,
correct?
yeah, that's a big stat. So let's kind of jump on that a little bit now. As we
Okay.
talked about these lymph nodes, right? And they're basically mini toilets that flush out waste. Every lymph node flushes a little bit more waste out. You've got roughly 600 to 700 of those mini toilets throughout the body, and they gather in clusters around really what I call super duper important regions. So that's where they go. And most of your lymph, the largest portion of your lymph, is in your gut, your actual gut, your abdomen. Now, if you think about that, it makes a lot of sense because 70 to 80% of your immune system is in your gut. So then you would want to put the biggest player in your immune system right there. Okay. So when you have any kind of gut issues, you got a lymph issue. If you have a lymph issue, you have a gut issue. And then people ask me which came first. And my answer is yes. I don't care. You're going to work it both ways.
Right.
Okay. But the other place that you have it, 1/3 of the 700, so let's just kind of get that number in our mind, is from the collarbone up.
Wow.
Now, let's just think about that for a reason. Why would the body have most of the lymph nodes there? What sits up there that's kind of important?
Your brain.
Exactly. Exactly. So those are going to be the ultimate drain toilets for the brain waste,
Yeah.
which I call brain muck. That gets stuck in the brain. And it's like I said before, what happens when waste gets stuck somewhere and it can't get out? Well, then you're going to get inflammation and you're going to have waste that accumulates. And that's not an environment that's conducive to cells being able to recover and heal and regenerate. They just start to slowly die.
Yeah.
They begin to decay.
It's
And
like a
they're
traffic
finding
jam.
now one of the reasons that lymphatics are starting to skyrocket is because they're seeing the lymphatic connection to brain health.
Mm. Mm.
Because they used to believe, here's the thing that drives me bananas. They used to think that there was no connection. And I'm like, first of all, there's no such thing. Everything in the body is connected. You're just not seeing how yet.
No connection.
Yeah,
What
they
is
call the brain an immune privileged organ because it
wow.
sits up there. And they didn't think the lymphatics had anything to do with it because they couldn't find actual lymph nodes like in the brain. But you have other stuff up there that drain. Here's the thing you need to know. Other stuff up there called different names that drains to the lymph nodes.
Is that the lymphatic system?
Yeah.
Yeah.
So the glial cells are just the kind of the immune cells of the brain.
Mm. Okay.
But you can't separate the brain from the body because they always communicate with each other. And when you have inflammation in what they call the peripheral immune system, it will influence the immune system and inflame the immune system in your brain. But here's what you need to know, it goes the other way too.
Mm.
So that's why when somebody gets a head trauma or a concussion, it can kick off problems down below. It's a two-way street.
Okay.
But for me, it doesn't matter because I'm going to work your lymphatics either way, and I'm going to help either one. Does that make sense?
It makes perfect sense. Yeah.
Yeah.
You often say in your videos and, on social media that you ask somebody where they're having pain and trouble, and then you look everywhere else. Can you talk a little bit about that point?
Yeah, sure. Yeah. That's kind of like my tongue-in-cheek joke way of saying I need you to kind of look everywhere else but where the side of pain is. So that's what stop chasing pain means. It means treat it, but don't chase it. And what you'll usually find in relationship to chronic pain, I'm talking, is that it's usually where the problem ended up, not where it started.
Hmm.
It's a big downstream problem that's usually been there for a long period of time before pain actually decided to finally show up. So pain is usually the last thing you feel when your body's trying to fix something, not the first. It usually hits you when you've exhausted all the possibilities that it's trying to solve the problem for you in the background so you don't have pain, so you can live your life. So when pain shows up out of nowhere, you've had an issue for a long time, my
Hmm.
friend.
Yeah.
Okay? So that's usually when I ask people, why today? Why now? Why not yesterday? Like, why didn't your knee hurt you yesterday? But there's a difference. I have to keep this in context. There's a difference between pain from an easily explained episode or trauma, where if I hit you in the knee with a bat, well, A equals B. I know why your knee hurts. And I'm going to treat your knee, but guess what? I'm going to work your lymphatics for that starting then. Okay. But if you come in and you say, Doc, my knee started hurting me today. It didn't hurt me yesterday. That's a whole different ballgame. That's not even close to treating the person the same way, not even in the same ballpark of treatment. So you start at the knee because one, the person expects you to start at the knee. And I do that because I want to calm the area. There's probably inflammation there. And if you have inflammation, what do you already know? You think lymph, lymph, lymph. That's what you need to be thinking. But I'm also going to treat that area because I want to show empathy to them that I get it. I feel you. But we need to look in a lot of other places here. And the reason I started to do that is because the way I look at it is this. If people have tried all these different therapies and all these different approaches and all these things to the area that hurt them when they came in to see me, I'm not going to do that. Because if that's what you needed, you wouldn't be there asking me for help because you would be better already. So in essence, you're just coming to see me because I have a different thinking process. And then I'm thinking, maybe it's not the knee. Or people may be looking at the knee, but then I'm thinking of, well, maybe you have some clogged lymphatics higher up in your groin and in your abdomen and your neck, and your knee can't get better even though you're doing all the right therapies because stuff just can't get to the knee and stuff can't get away from the knee. And I'm going to tell you that happens 100% of the time.
Wow.
So you have to look at the whole, here's a novel idea. You have to look at the whole human being in front of you, the whole person, not the parts, not the names of the tissues, not the diagnosis, the whole person. And then that's where the lymphatics and the blood and these assessments that I teach people come on into play. And I'll tell you how I arrived at beginning to create this approach
Please.
and the way that I treat people. I was always very frustrated since the very beginning of practices. Why in the world do I have to keep seeing this person so much? What's the deal? The human body should be way more resilient than it is. So either the person is doing something outside of the office that's keeping them that way, that one, maybe they know about, but they're not changing, or two, most of the time it's stuff that they don't even know that they're doing that's keeping them that way, right? Or maybe it's something that I'm missing, right? And so I said, I got to think differently man, I have to look at the body a little bit of a different way. So what I did was I started to look at really difficult, chronic, hard to fix, tough cases geared towards there, not your average back pain. So people came to see me that went everywhere else. And that was perfect because I had to automatically not think like everybody else. You follow?
I am.
I had to think differently. And the reason I got that is from my own experience of the lymphatics. So it's not so much that my techniques are magical or, they're better than other people's. It's just you get there when you understand how to think about why the body does what it does, because it never does anything without a reason, ever. There's always a reason for it. And once you can even ask the body and it'll tell you. And the way that you ask it is you use your hands. It'll tell you through feedback. You're not going to find, here's the thing, you're not going to find lymphatic issues through a test typically. You won't find it on an x-ray. You won't find it on an MRI. You maybe can visibly see it if it's lymphedema, but you'll definitely see it when you get trained on how to look for it. And you're definitely 100% of the time going to find it when you use your hands to do a hands-on assessment of a patient, which is one of the things that is most lacking in current medicine today is the physical touch of an examination. They don't do it.
Yep. I agree with you.
They won't even touch you before they order 5 billion tests on you.
Yep.
But all those tests come back. I don't see anything. It happens all the time. I don't see anything on your MRI. I don't see anything on your x-ray, and your blood work is normal. Meanwhile, I'll put the person on the table, and every place I touch, they jump off the table because it hurts. And I tell people, I don't care what the hell your tests tell me. Something's going on with this person. And to me, it's going to be the lymphatic system that you have to clear first. It doesn't mean that it's the only problem. It doesn't mean that when you clear it, it's going to magically unicorn fix everything. But what I will contend until the day I'm dead, if you don't look at it or you don't do something at least to improve its function, you are always going to struggle.
Yeah. Yeah. I think the overarching theme of this little segment here is not just the fact that it's overlooked and not often thought about, but it points to the problem that I think I talk about a lot on the show, which is isolation. We are programmed to look at the body in isolated parts. Yeah. We are programmed to think about the mind and the brain separately and emotions and all of those things separately from the physical body. We are programmed by our professionals. And I always say this with grace, but at the end of the day, at least from a conventional standpoint, they are just not trained. Therefore, they don't know. And if they know and they're still not doing something about it, then that's a whole nother thing, which is happening also, And so I think, to your point, like when people come in and they might not even have the expectation that they could get any better. Maybe they're even just looking at management, which is, probably some of the things that you see because they've been told so many times, oh, by the way, I have this thing. And also I wear it on my shirt in a badge. And here's my diagnosis and it will never go away. This is what I've been told that I have. And so can you just help me manage it a little bit? That's the thinking. That's the mainstream thinking. But at the end of the day, you're saying pain is information. Pain does not have to be long-term forever, but unfortunately, a lot of people think that it is.
Yeah. So pain serves one purpose all the time, and that's protection.
Yeah.
Right. It's trying to protect you from doing something further that can damage you, or it's pain. One of my favorite to say it is pain is your body trying to tell you, I need you to change something. And then people go, change what? I'm like, well, I don't know the answer to that, but I know you need to be doing something. Here's the key word, differently than you're doing now. And what I'm trying to tell people is, to me, that's a tap on the shoulder of the body going, hey, you should probably look at the lymphatic system here because it's going to be related to my pain in some way, shape, or form. And when we start to explain, like, because I want to get to it before the end of the podcast, is the body aquarium analogy, because then you're going to get it.
Yeah.
Then you're going to see how everything relates to each other. And I have to explain these type of relationships because I, you said it before, there's no isolation, but that's the way we get very myopic because, that's the way we're taught. And that's an effective way to learn, honestly, because you break something down to a piece because it's so overwhelming to look at the whole picture. But then this is what we forget in medicine is that you have to put them all back together because then they got to work all together
Mm.
in a single person, trillions of cells. And all of these body parts that we name, your body doesn't even know what the hell the body parts are. I mean, they're just arbitrary names. It's just going along zippity doo dah, doing its thing, trying to pull from anywhere and everywhere to protect you. That's its job, right? Because my tagline is it's hard to heal when you're dead. So survival is the number one priority for your brain, and everything that your body does symptom wise is trying to accomplish that task. And when you can understand that, everything that's happening makes sense.
Yeah. Yeah.
But you have to go through these systems, this kind of checklist. We're going to go over some today to see it. But the only way you're going to find it is to expand beyond where you're looking. And that's terrifying because it could be anything. And I understand that, but unfortunately, you have to get over that because that's how the body is. Like it can be unlimited things and it's hard to know where to start, but I'm going to make this very easy for you. In my program, you start with this thing called lymph. You start there and then you see how you move the needle, what changes. Okay. So may I move into the analogy of the?
I was going to say, talk to us about the aquarium and the fish tank because that's where you're going. Because I've heard you
I,
speak about it. It's a
yeah.
fantastic analogy, and it's honestly the way that I learned a lot more was just listening to this teaching portion. It's very easy to understand once you go through it. So yes, please let us enlighten us on this because it's fantastic.
Thank you. I really appreciate that. Well, I just got that idea from I was trying to be a better communicator and teacher so I could help my clients like get why I want them to do something. And I read something in a book that said, analogies do that really well. So if you can tie something that is brand new to somebody that seems like hieroglyphics to something that they already know, then they'll get it.
Yep. Yep.
And because otherwise your brain's going to shut off and you're like, you lost me at node, I'm gone.
Yeah.
But the fish tank, okay. And in order to explain this, I want to kind of plant the seed of something first. I had somebody who was very influential in my healing process say that chronic disease only occurs when you lose the ability to make new cells that work. And that was Dr. Jerry Tennant, who was a guest on my podcast. And I'm going to say that again. Chronic disease only occurs when you lose the ability to make new cells that work. Okay. Because if you can make new cells that work, then you should recover, right? And then you shouldn't have chronic things. So it's making new cells, but it's the caliber of the cell that you're making and the caliber of the environment that the cell actually has to live in. So then I started to ask myself, okay, you got trillions of cells, but this is where I went down and said more myopic, like, what does a cell need to actually heal itself? And it needs a lot, like a ton. But the two primary things it needs are this. It needs nutrients and oxygen. So it needs stuff to go into the cell and it needs oxygen to go into the cell so it can create energy. Okay. And the only way it's going to get to the cell is through blood flow. That's it. Okay. That's it. So it's going to take that stuff. It's like, hey, great. You gave me the nutrients. I'm going to use the nutrients and then I'm going to create energy and then I'm going to poop. Because that's what you do. When you eat food, you create energy, but you got to poop it out. So the cell poops it out. And then the second part of the equation of what a cell needs, it has to get rid of its waste. That part. That's the part that I was missing. That's the part that most everybody else is missing because they're too busy on the nutrient side, putting stuff in. But here's what you'll learn. If you can't get stuff out, the body won't let you put something in because it's not stupid. It can't give you what it can't give you, right? Just think about that. If you can't get something out, it's not going to let you put something in.
Yeah.
Right. So let's talk about the environment around the cell that allows that to happen. Let's think about a fish tank. So my program is called Body Aquarium Lymphatic MOJO. The cool analogy about that is that we know, or most people might know, that your body is mostly liquid. It's mostly water. And your lymphatic system is 90% water. So if you're dehydrated, and most humans are, you already have a problem with your lymphatic system. And it's like, you're crushing me here, Perry. You're not giving me any water. That's a problem. Day after day, week after week, year after year. Okay. So the body is mostly water. And you've got this container, your body and your skin and stuff, that it lives in. Otherwise, it leaks out. Right. Think about that as a fish tank. So a fish tank has the actual tank. That's your outside body. Inside of the tank is the water. And for you, the primary fluid that's inside of you is called interstitial fluid. Interstitial just means the fluid between the cells of the body. Now, cells in the fish tank are fish. So if I put the fish in the tank, they're moving all over the place, okay? And the fish are in the tank. What you do for the fish in the tank is that you have water in there and you feed the fish, right? So you give food into the tank, just like you take food in the mouth. And then the fish poop in the tank. And then your cells poop in your tank. And then the waste has to get out of the tank. How does the waste get out of the tank? How does the waste get out of the fish tank? Filters, right? Sometimes you see a filter depending on the type of tank you have. If you have a nice big tank, lots of fish in it, you see a couple of filters up there in the corner and it's bubbling. Reason that's doing it is I'm putting oxygen into the tank because that's what the fish need to breathe, just like your cells, right? But the big part of the filtration system, you don't see. It's tucked underneath the tank, right? Under where the shelves are. And you see filter after filter and pipe after pipe. That's the lymphatic system for you. Okay? Now, what happens if your filter system with your fish tank works good? Then your fish tank looks awesome. The water is clear. The fish are thriving and happy. No disease, no muck stuff along your tank. Thing looks great. What happens if something goes wrong or the fish filter system underneath doesn't work so well? Here's what I'm trying to tell you. You don't notice it right away. It's not instant. Because that's what we look for in our healthcare. Instant. Otherwise, you're healthy. No, doesn't mean that at all. But maybe you check back a week later. What does the water start to look like? It's like, your fish tank's looking kind of murky there, man. And then you put your finger in there and you got all these algae and this bacteria and this muck. It's called biofilm growing on the glass. Well, that's what happens inside of you is that your cell water turns filthy and you get what? Bacteria and viruses and toxins and parasites because they love that kind of environment, man. That's like going to the beach and bringing a picnic basket and hanging out, because when that happens, you get low oxygen. Oxygen gets low. And when oxygen gets low, those types of critters that are trying to munch on you come out and they feed on you. The bacteria that's already inside of you. And we know you got more bacteria inside of you than your own cells. So then if you don't do the fish tank at all, if you see it, but you don't change it, it gets worse. And then if you look inside of the tank, the fish are struggling. Some of them may start to have like disease on the scales. But what you see is when you look inside, some of you may be listening to this, not necessarily watching it, but I'm going to be on the camera here and I'm going to be demonstrating like I'm struggling for air. You ever see a fish go,
yeah,
big mouth like this?
yeah,
It's suffocating. And that's what's happening to your cell. And then those are all the, crazy medical names for all these processes that happen that lead to you getting inflammation. Okay. And then the cells eventually die. And then I ask you this: do you think that that's an environment that would be conducive towards brand new fish surviving?
no,
No, it wouldn't be. And that's the same thing for your own cells. So you're trapped in this muck that can't get out. And when stuff can't get out, your body has to say to itself, we've got to do something here or Perry's going to die. Then your immune system says, I'll do it. And then your immune system kicks in and then you get what? Inflammation.
yeah. Wow.
So what I'm trying to tell people is that your immune system is not broken. It's actually doing its job. You're just stuck full of stuff that you can't get out and it can't turn off. And here's what happens. Here's what the medical model is that one, they don't even notice. They don't even think about the filters underneath. What they'll typically do is they're going to say, dude, you got to get new fish and you got to replace the water and then clean your tank. So that's what they'll do. They'll take the water out, they'll put new water in, they'll put new fish in, and then they'll clean the sides of the tank. And this is all your medications, all your therapies, all your whatever it is. Okay. And I'm like, okay, great. It looks good for a little while. All right, you're good. Then what happens about 2 weeks later? Geez, man, that tank's looking not so good again. And then I started to find my answer of why does stuff keep coming back? Yeah. And then I said, did you clean your filter system? And people go, filter system? What filter system are you talking about? Because until you clean that filter system, what's going to happen? Same thing, over and over and over and over. What I want people to know is it's the same filter system, it's the same muck, but when you get the inflammation, people can get different types of chronic diseases or illness from the same muck. Your disease is going to change based on a lot of different things. Some of that's when it can flip your genetic switch, because that's what they tell you with epigenetics. It's not the gene that does it, it's the environment that pulls the trigger of the gene.
Yeah. Wow.
So then that's going to be a really good time to not have a yucky environment around. And then what you'll find, like I said before, is that most of your symptoms are a healthy reaction to a toxic environment. It's not that you're broken. Because trust me, you'd be way worse you'd probably be dead if you didn't have all those symptoms. Because all those symptoms are trying to get stuff out of you. If you think about it.
Yeah.
Right? Fever goes up because it's not trying to get you to suffer, it's trying to kill something. You're going to get mucus out of your nose and out of your throat because the body says, holy cow, if I can't get something out of you, I better coat it with something so it doesn't do more stuff. And then maybe I can get it out of it because you'll hack it out that way because it's not able to get out through the other ways that it's supposed to get out. And that happened to me One of the issues that I suffered with for many, many years was I had a lot of sniffing all the time because I had a lot of postnasal drip all the time, stuff dripping. And I would constantly have a feeling of phlegm in my throat. Every 5 seconds, I was like this. And it wasn't habit, it's because it was stuck.
Mm.
And it was annoying for people to be around me. And when I look back on it of me teaching, I was like, wow, I didn't even know that I was doing that. But here's what happened. When I began to work the lymphatic system for the for the first time in like 15 years, I could breathe through my nose. I wasn't hacking. I wasn't sniffing. And I was like, and it made sense because I didn't have to anymore because I started to flush the toilets. And then this is when I had to go back to my history because you're going to find the answer of why this stuff's going on in somebody's history. It's always in the history. 20 years ago, I had thyroid cancer and they removed my thyroid gland and they had to take out a significant amount of lymph nodes in my neck because it metastasized to the lymph nodes. So they took out my main toilets and they took out here, which is one reason why I later, because these were gone, I had to use the mucus. I had to use the nasal drip, but that also contributed to me ultimately getting my neuroinflammation and my brain fog because at the time I wasn't thinking about the toilets being gone. And then I started to think about why in the hell did you get thyroid cancer in the first place, man?
Mm. Yeah.
Because cancer just doesn't jump out of nowhere. It builds up over time. What many people don't know is that you always have cancer cells in you. The only thing that keeps it from progressing is your immune system. And your lymphatic system kills cancer every single day so you don't end up with it. So here's what I already know. If you got cancer, you had a lymph problem from a long period of time.
Yep. 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 Yep.
And not just where your cancer is.
That's a good point. Yeah, that's a good point. Just a quick note, because I think, and I know you'll probably jump in and just go off of what I say, but for the longest time, and I learned this largely from your work, is that I feel like we often look at our problems and think about what we need to take, what we need to add, what we need to
Mm,
do. And
right.
I think it's really mostly the opposite because, and you've said it in a way, and I can't necessarily remember the way, but we have to let things go before we put it in. So we
Right.
can do all the things in the world, like take all the supplements, which I'm not knocking supplements. I take supplements. I mean, I took some this morning, like always. But is that stuff really absorbable? Is that stuff really going to work? The drainage has to happen before we put the things that are quote unquote good for us back in. And
Right.
so I feel as though so many of us, myself included, have missed it, right? While trying to heal, trying to get better, trying to optimize, trying to heal chronic pain, illness, et
Mm.
cetera, et cetera, et cetera. And so I know you're going to jump in and probably go off of that. And then also let's
Oh, yeah, I'm going
then
to go off.
yeah, you are going to go. I know you are. And because like you get heated and I love it. I love it because you're so passionate about it. And then we
Well,
can talk
yeah.
about like the like where like the way that fluids travel in the body, because I think that is just like absolutely essential. And I didn't know that until I started to follow you. So you take it from
Yeah.
here.
I'm all about the fluid flow.
Yeah.
That's the primary thing that I look at because nothing moves in the body without fluid, period.
No. Yeah.
So
Yeah.
I look at the flow routes. Okay. And I, I love that you brought up nutrition and supplementation because listen, they're a key piece of healing that can be. But I have so many people that come to see me who've changed all the diets. They've tried different types. Sometimes they got a bag full of 30 supplements.
Yeah.
and they spent $1,000 on supplements, $1,000 on testing, and they're no better or if not worse. So here's what you have to remember. Because I'd rather you have good stuff than eat, chocolate chips and a yoo-hoo. You follow? I mean, I'd rather you eat good than bad.
Yeah.
But what I want you to understand is that whether it's considered good food or bad food, because it's all going into the same place. So let's say you're going to put like the yoo-hoo in, which is awful. Well, it's got to go through the same process. It has to go into your gut. It's got to get broken down. Then it's got to go into your gut. And then that's going to try to get to your cell. Your cell is going to use the yoo-hoo and it's going to poop and it's going to go out if it can. But guess what? Let's say no yoo-hoo, but I'm eating broccoli. Good stuff. Or I'm taking all these awesome supplements that are supposed to be good for my lymph. They're going to the same place. So they're going down into the stomach, and then they're going out into the cells, and they're going to make waste too. What I want you to understand is they both make waste, whether it's good waste or bad waste, it's waste. I don't care. The good waste has got to get out. The bad waste has got to get out. And if the good waste can't get out, you're going to stay sick, even though it's good stuff going in. That's why they have a saying in osteopathic medicine, classical osteopathic medicine from Andrew Taylor Still, who was really big into lymphatics and blood flow. That guy's my hero. And it's just 3 words that summed everything up for me. And it's this: drainage precedes supply.
Yes.
I'm going to say that one more time. Drainage precedes supply. What's drainage mean? Getting rid of waste, many different ways, but primarily we're talking about the lymphatic system, which ultimately makes its way out back into the circulatory system to go out through your pee. Okay? It's got to come before supply. What's the supply side? Your food and your supplements and your nutrients and your oxygen. Because remember I said before is that it's good that you're putting it in your body, but just because it's going into your body doesn't mean it's going into the cell. Key. That's 2 different things right there.
Yeah.
Everybody, that's 2 different things.
Yep.
Because it goes into your stomach, but the ultimate destination is the single cell. And this is where I ask people, it only gets to that cell through the blood flow. And once it exits that's even considering that you have good blood flow. But I already told you, if your lymphatic system is stuck full of muck, your blood flow system is going to be stuck full of muck. So I already know your blood flow is not that great. And you end up with what they call thicker, more viscous, dirty blood. It doesn't flow well. It's like water compared to engine oil, 2 different things. So when that nutrient or supplement wants to go into the cell that leaves the blood vessel through what's called a capillary, and guess what it has to cross to get to the cell? Fish tank. The interstitial fluid. It's got to go across your crappy fish tank. And the cell's on the other side going, I'm not letting you in here, man. Right? But even if it did let it in there, it's going to poop it out into an area that's already full of poop. They can't get out. So here's what happens is the more you take of that stuff, the sicker you get. Because I'm stockpiling cell poop. I'm stockpiling debris. And if you think about that, you're like, holy cow, that makes total and utter sense. I'm like, I know, because that's how physiology works. You just have to envision it to see it. So that's why this elimination process is so powerful, and why when you do our big 6 or you do lymph work, people say, I'm starting to feel better, or I feel less tired. I feel less fatigued, I feel less lethargic, because two reasons. It takes an enormous amount of energy to detoxify your body, a ton, right? And you're struggling to detoxify. But when you start to move that stuff out, now nutrients can get in. Then you can make more energy through what they call the Krebs cycle. So you can have, wow, you know what? I'm sleeping better. I feel more energy. I'm not tired or fatigued. And it's not just the nutrients I'm talking about, it's the oxygen that you're breathing. Oxygen also has to get to the cell. And it's the same way, man. You can have normal levels of oxygen by checking your pulse ox on your finger, but that doesn't mean that you have enough oxygen going to your cell. They're not even close to the same thing. So the oxygen is in the around the red blood cell, but it's not going to do you any good if it can't get off the red blood cell and get to the cell it's trying to get to. And then I ask you again, what fluid does the oxygen molecule have to pass through to get to the cell? And you better be saying fish tank. That's why the fish are struggling to breathe in the water. And here's what I want people to know. You can have a dirty fish tank for decades and not know it. You can have poor blood flow to a region and not know it because you don't have pain yet, or you don't have disease yet. But that's the person who gets chronic inflammation around a region, and then you get decay, degeneration, year after year after year, until the body is trying to do the best it can with what it's got in the moment it's in until it can't anymore. And that's why today you're sick and yesterday you weren't.
Yep.
So that's a big piece of that puzzle. Now, there is an actual term for this inflammation. Okay. And it's called interstitial inflammatory stasis. So I'm going to break that down so you don't realize he's doing the medical gobbledygook. What does stasis mean? Stagnant.
Static, yeah.
Not moving.
Yeah.
You don't want stagnant fluid anywhere because you're going to get disease, period. If you don't believe that, go drink from a stagnant pool in nature and you're dead. Okay. What's inflammatory? Inflammation. Yeah. What's interstitial? Remember what I told you that is? That's the fluid around the cells. That's the fish tank water. So when the lymphatic system doesn't work well and you can't get blood flow to something, if you can't get blood flow to something, that means you can't get blood flow away from something. That's the veins. Then you get stasis, stagnation around an area, interstitial inflammatory stasis, and you get decreased oxygen. And when that happens, pain shows up. Pain is going to show up, my friend, and it's going to keep coming back until you start to get that filter system functioning again. Okay. That's what this whole work is based on. And that's also why we teach you 6 places and not 1. You cannot isolate the lymphatics just around your pain site or your area of injury or inflammation. That's not enough. It's not enough. You have to do the whole system because the blood that's in that small little spot right there circulates out through the whole body and tries to go back to the same spot. It's a full unit this way. So all those lymph nodes, all 700 of them, talk to each other, every single one. And you can have a problem in a lymph node that is nowhere near where your complaint is. That's the reason why your complaint's not getting better. But you want to know why nobody's looking there? Because it doesn't hurt.
Yeah.
And then here's my next question. How do you know it doesn't hurt? What's the only way you're going to find out if it hurts?
To touch it.
What I told you before, I'm going to stick my fingers in there and use my hands and see if it hurts.
Yeah.
Because if it hurts, I automatically know you have inflammation.
Yep.
And if you have inflammation, automatically know you have a poor lymphatic system function. And that's the part that's missing in medicine, is nobody looks at all the other places. And I'm going to contend that every single one contributes to why your single place that you're focusing on doesn't seem to be getting any better. And it's also empowering because, you're so focused in on that one side of pain that you're in your quicksand that one piece is not going to get any better. But why don't you focus on all the 99% of the other pieces? Because you probably got a lot of them that are doing really well, or they're trying to. Because that one single piece that everybody's chasing after is crying for that. Hey, man, can you look at all those other places for me too? Can you at least check the 6 places for me?
Yeah.
Just do that.
Yeah. Yeah.
That's so. The longer I do this, I realize that I'm not really trying to teach people techniques to do, because there's a billion of them. I'm trying to teach people a better way of thinking, a thinking process, to see the bigger picture of why the body is doing what it's doing, and then trying to get yourself to recover from, that hell that you're living in.
Yeah. Yeah. I know this is probably a silly question. Well, maybe not. But is it pretty safe to say that most people probably have a lymph issue today?
Yeah, that's my running joke. If you got a lymphatic system, it's a mess.
You have a problem. Yeah, I mean,
You just don't know it.
you just don't know it yet. Or maybe you know it. Well, there's probably a crop of people
Well,
that know it. And then, but most people probably don't.
no, they don't.
Yeah.
Well, here's the thing. You're always moving lymphatics,
Yeah.
because if you didn't, you'd be dead in a day. It's just how well you're moving lymphatics. Okay? And so this is a good time to cover this.
Yep.
2 things move your lymphatics primarily. One is moving, like just moving yourself has muscle contractions, and those that pumps fluid. That's one reason why jumping up and down on the balls of your feet is so great, because that pumps your calf, which is the second heart, which pulls veins and lymph flow back to your neck to go to your heart. Okay? So movement does that. And your lymph system has these little tiny micro valves called lymphangiones, which means tiny heart. So they kind of micro pump on their own all the time. Because at night you'd wake up and you'd be the Stay Puft Marshmallow Man, from Ghostbusters. You'd be really swollen, right? And breathing moves lymphatics, particularly diaphragmatic breathing. And the diaphragm is a muscle that sits below your rib cage and above your organs. And then people say, well, why does the diaphragm do that? I'm going to give you one word: pressure. Every time you breathe in and out, you increase pressure, you decrease pressure, you increase pressure, you decrease pressure. That's the exact same thing that a plunger would do when you're trying to unclog your toilet that's stuck. Increase, decrease, increase, decrease, increase, decrease. And of course, it's above your abdomen, because that's where most of your lymph sits.
Ah, yeah.
Right? And the largest lymph node in your body sits right in the center of your belly too. That's really important. And it's clogged on everybody. So movement moves lymph, and breathing moves lymph. And every time you get a massage, you're moving lymph. Every time you dry brush, you're moving lymph. But this is when people say to me, well, Don, if I'm breathing all the time, I'm a breathing ninja, man. I take 500 courses and I move all the time. And I do all this sort of stuff. I get massages all the time. Shouldn't my lymph be okay? Well, should is the operative word here. Because sometimes the blocks are too deep and too numerous that they can't unblock it anymore. And I'm going to go back to the toilet analogy. You ever had a blocked toilet and then you go to flush it, and sometimes when you flush it, that's enough pressure to pull it through?
Yeah.
Sometimes that doesn't work out well.
Right.
And if you keep flushing, it's getting really close to the top, and now you're freaking out.
Yeah, you're holding your breath.
So then
Literally.
how do you clear it?
Plunger.
Well, you got to use your hand. You got to manually move some stuff. You're going to use the plunger or you're going to snake it.
Yeah.
But my point is you have to get in there and manually unblock it. Okay. And that's the same thing here is that that's why we have you work on specific areas by hand to unblock the toilets. But then this is when somebody's going to say, well, I get massages. That should move the lymphatics. Yeah. But there's a way you have to clear your blocks in order for all of the blocks to be removed. So what I mean by that is that let's say your toilet is blocked in your house and you snake your toilet, right? But that's not the only place you can have a block. What happens if you're blocked at the drain in the street where the toilet's trying to go?
It's gonna come back.
You got to clear that
Yeah.
first because otherwise you're going to waste your time up there. So that's where, listen closely, the order of how you clear the blocks matters and how well the drain works.
Yes.
So
Yes.
that's why I don't have people just start rubbing body parts and starting from the hands and the feet and moving lymph. It's going to move lymph, but it's not as efficient as going to certain places first in these bigger pipes to open them up. These, I'm going to use a key phrase here like Dr. Evil, deeper pipes. And that's why we do the big six.
Yes. Enter the big six, which
Right.
and I told you off air, I have done for a couple years now. I want to say I'm fairly religious. I don't always do it. I would say I probably try to do it at least 6 days a week, but I'm at the point
That's
where I
great.
can do it that often. And we're going to get into like why someone might not have or might not be able to do it as often
Yeah.
right away. So let's get into the big six because I want to just share this with the world because it has been
Mm.
so instrumental. As I was telling you, it's been so instrumental for me personally. And I have a little bit of a mobility situation that I am still recovering from. And so it's been something that I've had to be really consistent about because I don't exercise the way that, quote unquote, normal I don't know how else to say it, but like normal people, they go to the gym, they go for long walks, they go for a run.
Mm.
I don't have that ability yet. So for me, I have to move my lymph in other ways or go in the sauna and do things, but I have to do the big six before I go into the sauna or before
Mm.
I get any kind of therapeutic work. So let's just get into it. What is the big six? How do we do it? Take it from here.
Absolutely. Well, thank you for the opportunity here. I can tell you that the big six can change your life.
It can, and it has.
I get messages every single day from all over the world from people, and that still just it hits me in the heart sometimes about how they share with me how much it helped them, how they couldn't believe that it was so simple, and how it worked so well because it was so easy to do, which now you know why. I
Yeah.
just gave you an hour and a half reason why.
Yeah,
So when I
exactly.
show you when you're rubbing and slapping, or I'll give you different options, it looks like you're not doing much. Wrong. Like you're doing a ton, especially when you do it in the particular order that I'm going to show you. So the big six are the six primary places where you have the largest gathering of the lymph node body toilets. And they get stuck a lot. And that's where the backflow happens, the toilet's backflow. And it just so happens they're situated around the primary joints of your body that are supposed to move the most. Operative word is supposed, and the other one is move. Now, what did we say before of what moves lymph? Movement. So when you don't move these joints, lymph gets stagnant. That's why people sitting all day long have an issue. And that's a big problem.
Yeah.
Right? So we're going to clear these six areas. And the reason I call them big is because it's a big deal, man, to do this thing. Um, but in order to understand why it's done in this order, I'm going to get a little geeky.
Please.
I'm going to cover a little bit of the physics of fluid flow. And a lot of people going, oh, seriously? No, this is awesome.
No,
Okay?
yeah, no, it's essential
Because
and it's
I
easy to,
study this stuff of how fluids move because I need to understand that stuff with the human body.
yeah, yeah. No, you
And there's
explain
a
it really
lot of
well.
there's a
You do.
lot, thank you. There's a
Yeah.
lot of different principles of how fluids move. Okay.
Yeah.
But the one I'm going to pay attention to here, all right, is based on hydraulics or what they call hydrodynamics. That's the properties of fluid flow. And they're just really cool words. When you're speaking about the lymphatics and the veins, which are the primary waste fluid management systems of the body, they go like this. High pressure wants to flow towards where low pressure is. High pressure automatically wants to go to where low pressure is because that just makes sense. It's easy to do that. The easiest way to envision that is to look at man-made water dams. You have all the water on one side, that's a lot of pressure. But if you open up the door of the dam, where's the water just go?
Yeah.
What happens when you close the door? It can't get there even though it wants to. That's my point. Okay? All you need to know, you can figure anything out in lymphatics when I tell you this one thing. The lowest pressure in your body for vein flow and lymph flow, that's the main drain at the street. That's where everything wants to go, is going to be spot number 1. That's the collarbone. Both sides, above and below, the whole thing, right? Every single piece of your body wants to drain to that spot. Your feet, your hands, your brain, your back, you name it. Your liver, it's all trying to go there. 80% of it wants to go to the left side of the collarbone. The other 20, 75, 20, somewhere in that ballpark, goes to the right side. The point is they want to go to both. So if that's the lowest pressure, let's think logically for a moment before I give you the answer. Where do you think the highest pressure would be in relationship to the collarbone? Probably the furthest distance away. So what on the body is furthest away from the collarbone?
The feet.
The feet. So that's why people get a lot of swelling in the feet. And plus you have gravity.
Right.
So not only is it really far away, it's got to fight this relentless thing called gravity that just never stops. Okay? And the hands too, right?
Oh yeah. Yeah.
What about above the collarbone? The brain.
The brain. Yeah.
So the brain is trying to drain its waste down to the collarbone. So let's think about what would happen if I blocked, not completely because you'd be dead, but let's say I shut off 50% of the drain here at your collarbone. Where's all that waste going to go now that it can't get to the collarbone?
Yeah.
Back out.
Back out. Yep.
To everything else that people complain of issues with. So what you have to do is you always have to clear the collarbone first. Rule number 1. Now, in my world, I clear the collarbone no matter what you have. If you come on in with a hangnail, I'm clearing your collarbone, and I'm not kidding you. Okay? It's that big.
Yeah. Yeah.
When you open that up, all the other numbers, 2 through 6, are going to start draining automatically. Just because that's how it works.
Mm-hmm.
Now, spot number 2 is on the side of the neck, up behind the angle of the jaw, below and behind the lobe of the ear, and what they call cervical 1, cervical 2, atlas and axis, the first 2 bones in the neck that sit below your skull. That's the largest lymph node in the neck on both sides. Now, 2 is trying to drain towards 1. So I'm going to massage and work 1. We'll show you how later. I just want to show you the points first. Then you automatically go to 2 and you start massaging 2 because that's going to help 2 go down even more. And then anything above 2 is going to start going down as well. If 2 is blocked, your brain's a hot mess.
Yeah. No,
Period.
seriously. Yeah. Yeah.
Okay. That's a big one. That's a huge one. Spot number 3, because we're coming to the halfway point, is at the shoulder joint. Now that makes a lot of sense here because, you're supposed to move your arms around a ton, right? And that's the one that gets clogged a lot in women who have issues with breast cancer, implants, explants, all sorts of stuff in here. And this area gets clogged and then stuff stays in here. And then you get all sorts of problems. And they remove a lot of lymph nodes in there with a procedure, which compromises you even more.
Yes.
And then now the toilets are going to backflow everywhere else, especially in your brain, man. Oh my goodness. What's quite fascinating is that they found that I'm going to sidetrack it from but it's called amyloid protein in the brain that's caused the inflammation. One of the largest spots that they find it is the axillary lymph nodes.
Wow. Wow.
So what happens if your axillary lymph, that's called axillary, doesn't drain?
Goes back
Well, it's
out.
going to stay up in the brain.
Yeah.
Okay. So when you have poor posture and you're rounded forward and you're sitting and you're slumping and your pecs are really tight, you clamp down on your nodes. So that'll be 3. Number 4 is going to be the entire abdomen, the whole thing, from belly button up, the whole sucker. Right? 5 is the crease of the groin where your pants crease when you sit. Those are called inguinal lymph nodes. And they're a hot mess on everybody.
It's true.
Number 6 is behind the knee joint. Behind the knee joint. And that's the one that everything from your foot has to get through.
Oof.
Now think about all those joints, how they sit when you sit. They're bent and they're what? Tight and trapped. So all day long, you're choking off your lymph flow 24/7. Now, what you need to remember is this. Everything in your foot or your lower body is trying to get to your collarbone. But in order to get through your collarbone, it has to pass number 6, number 5, number 4 to get there. So that's why you have to clear from number 1 out. And that's also why you don't start brushing at your feet first.
Yes, good point.
Because you haven't cleared 6, 5, and 4, and 1.
Yeah.
So all I'm doing is I'm pushing muck into blocks. So if you do 1 through 6 first, and then you scrape and have at it all over the place. Arms, legs, everything. And then people say, which way do you scrape? Well, I ask you, which way does the fluid want to go? Where does it want to go? Collarbone. Just scrape to there. And because the fluid already knows where it needs to go. It's not stupid. It knows how to get there. You just have to open it up. Yep. And that's what you did. And then this is when we say, okay, how do I open it up? And then I'm going to say, it's up to you. Yeah. Whatever you want to do. Yeah. I just don't want you to mess up the order.
That's the most important thing.
Yeah. Yeah. Because this is where I showed you before. Is I'm going to show you different options. I don't care what you do here. I'm going to teach you like circles, spirals, rotations. I tell people, you can draw hieroglyphics here. I don't care.
The alphabet.
You can use your hand. You can use a brush. You can use a gua sha tool. You can use I use a vibration massage ball. They work freaking awesome. That's one reason why we produce those, because we like that a lot. So the only number 1 rule is this: don't cause pain when you do it. No pain. And then they say, how much pressure? And here's my answer. Enough.
Yeah.
And I'm being tongue in cheek, but I'm not. And the
Yeah.
reason I say that is because it might need to change based on the person that you're working with and how sensitive an area is, how blocked up an area is. You know, the only rule is this: if you cause pain, I already know you're pushing too hard. You understand?
Yeah. Yeah.
So just start off light, and then they say how long. That's up to you. There's no magical unicorn number where if you do 10 seconds as opposed to 12 seconds, it's going to work or not work.
Right.
I always tell people like start off with 5 or 10 rubs, and they go, Doc, why'd you choose that? Well, because it's less than 10 to just less than 20 to 30. Like I just need you to rub there, but I also need you to actually fit this into your life so it's doable.
Exactly.
So I
Exactly.
had to make it, but what they call tactical and practical.
Yeah.
My friend Dr. Kerry Jones says that phrase. I love that.
Yeah.
Tactical and practical.
Yep.
Like, hey, I would work my lymph, but it's going to take me 30 minutes. No.
Nope. Nope.
So
I'll
when
tell
you
you
do
right
the lymph
now.
here, you can do the big 6 in 1 minute, 2 minutes flat.
Oh yeah, like I say, I probably get done in 90 seconds, and I'm like you.
Yeah.
I'm like I just don't do well with things that are complicated, especially right now in my life. Just I want to walk the other way. As soon as someone tells me it's going to take more than 5 minutes, 10 minutes, I'm like, no, thank you. So
Yeah, you have
yeah,
to. So that's one of the reasons why I evolved this too, is that it's not going to do you any good if you don't do it. And when you're really sick and tired and fatigued and lethargic, you don't have a lot of energy anyway.
exactly.
So I'd rather you do it and be consistent with it.
Right.
And effective things don't have to be complicated either.
Yeah. Yeah. Well said. Yep.
Most people overcomplicate things just to make themselves more valuable. It's really simple. Okay. But simple are basics and fundamentals. That's what this is. So if you go to the collarbone, I usually just tell people, I like to start on the left side because that's where most of the lymph drains and it's the heart side, but it's okay. Whatever one you want to start, just always do both sides.
Yeah.
And just take your hand and just massage on, below, and above the collarbone and do some circles clockwise and counterclockwise and change your speeds. Go a little slower, go a little faster. Then you can rub kind of up and down, side to side, in different directions. Okay. Because that's the way the tissue moves all over. And rub that for about 10, 20 seconds. And then I like to add a little bit of light tapping stimulation here because that's just a form of vibration. I learned a lot of these tapping techniques from studying Qigong and Eastern medicine. They've been doing this stuff for a couple thousand years because it probably works,
Mm-hmm.
right? So you don't have to overcomplicate it. And then you do the same thing on the other side, right? Rub here, just like that. Then you go to spot number 2. Okay? I like to do one side at a time on this one. The reason being is if people do both sides at the same time and they push too hard, they clamp up the carotid artery, blood flow to the brain, and they go night-night. So you don't want you pushing too hard right here at the same time because you're going to go timber. So
Yeah.
just do one side at a time and then work your way over.
That's
Okay.
interesting because that was intuitive for me because sometimes I do both side, not here, but mostly like my knees and my knee, or I should say spot 5 and 6, I do at
That's
the same
fine.
time, but up here I can't. I have to do everything one at a time.
Yeah. Well,
Yeah.
your brain kind of innately knows. Don't do that. That's not going to work out
Yeah.
well.
Yeah. Yeah. Wow.
Yeah.
Amazing.
Because that's the main blood flow route to the brain.
Wow.
And just do this side and this side. And
Okay.
then you go to 3, you go right at the pec muscle
Mm-hmm.
in front of it and a little underneath, kind of near the armpit.
Yep. Right there.
And just slap and tap there as well. And do the other side. And then when you do the belly, I'm not going to stand up and just walk you through it because, it's pretty simple to do. You place your hands on your belly. Your hands can be above each other like this. If you're on
Mm-hmm.
camera, they're stacked. And then the other one, they're actually physically on top of each other. Either one is fine. And then I want you to rub your belly in any direction that you can possibly think of in the universe. Up, down, left, right, circles, spirals, rotation, figure eights, whatever. All right.
Yeah.
Do the alphabet. I don't care. And then do belly slaps.
Mm-hmm.
Now that's the one that I'm airing towards this one, tapping a little bit longer. So 10 taps is great. But if you can work your way up from 25 to 50, that's gold.
Oh, okay. Okay.
The reason being is such a big area, it's so deep, and you're also going to really stimulate your vagus nerve when you do that to help you relax.
Okay.
Okay. So work your way to 25 to 50 eventually. You're welcome because you're going to like that, and you're probably going to poop like a banshee.
Yeah.
Okay.
Yep.
Then number 5 is the crease of the groin. Pretty much along the whole thing. Just do the big giant circles around the crease of the groin, and then go along the crease itself, and then straight up and down. Straight up and down.
Okay.
That's one of the most important areas of the whole body because that's the only way that blood gets to your feet is through that pipe. And it's the only way blood gets away from your feet, through the pipe going the other way. That is such an important area. I can't even begin to describe to you how important that area is.
Yeah. I've learned the hard way.
Yeah.
Yeah.
It's massive.
Yeah. It's massive. It's a huge part of my story too, from a
Yeah.
personal perspective. And when I wasn't working that area, it was even worse. So I know.
Yeah.
Yeah.
Yeah. And then the last one is behind the knees. Just do your circles and do your slaps and the taps. And in Eastern medicine, they call the back of the knee the magic back point because it helps people with lower back
Ah,
pain.
yeah.
Right.
Wow. Yeah.
And there's a ton of physiological reasons why that is. But with this one, is primarily because of the lymph and the blood flow. But you get those. Right? And then you want to move the body after that. And I like to just kind of jump up and down like a little pogo stick, like up and down, like I'm on a little mini trampoline.
Yeah.
Okay? Because you have built-in trampolines called calves. And that's what they're there for. Like this one. You shake your arms out, breathe in and out through your nose if you can. That gets the diaphragm moving and going like that. Okay. And that's it. And once a day is enough to start because it's pretty powerful.
Yep.
And I'm going to get into some common questions that I get asked
I
because
was going to say,
I've done this a couple times.
yes, you have.
Once a day is often enough. And remember the phrase, more isn't better, better is better. You have to earn the right to do more than one. They say, is there a better time of day to do it? No, that's up to you. It's just when you're going to do it. Some people like to do it when they first wake up, which is my preferred time. Some people like to do it when they're going to bed. It's up to you. The reason I like it in the morning is because you have a long period of inactivity at night and lymph gets pretty stagnant at night. And when you wake up, many people are really kind of tight and stiff and they're like the 10 man. That's the first sign you got a lymph problem.
Yes.
So you slap all these things and you jump up and down a little bit. You'll be ready to own the day. Some people like to do it at night to prime the pumps for moving, but also some people can't sleep because you just slap yourself and they're wired. They can't sleep. I tell people, do it both ways and you choose the one that your body likes.
Yeah.
After you do it once a day, you can try it twice a day. And if you still feel good doing it twice a day, that's usually enough. Now, what determines whether you should do it again is that detox reaction that we mentioned before. If you feel worse before you get better, which is likely going to be the case, because you're going to stir up this muck that's been stagnant for a while, and then you're going to get symptoms because the immune system's got to bag it, tag it, and kill it that comes out. And you might initially have worse pain symptoms, and that's normal too, because you change blood flow routes everywhere, and you're going to change how you feel when you get blood to places that hasn't had it in a while. So don't freak out. The detox is normal. Here's the caveat. Don't do the big six again until your detox symptoms begin to show improvement.
Important.
It could be a day, it could be a week, because you don't want to overwhelm the system that's already trying to keep up. Now, how can you help the detox is make sure you are well hydrated before you do the big six.
Yeah, that's a big one because I realized I've also seen some things just self experimentation. If I don't drink water and I do the big six, funny story actually, I did the big six probably about 20 minutes before a show one time and I was not hydrated and I had a tickle in my throat almost through the entire episode and I was
Mm,
coughing. So I had
yeah.
to sort of like clear that and I just thought, okay, I can't do that again, you know? So yeah,
Yeah,
hydration is
hydration
key.
is really important. And like I said, most people are dehydrated.
Yeah.
And also, here's a caveat. Um, if you're constipated, doing a big six might not work well because you're already backed up with the poop chute and you got toxins inside of you. And then when you do this, it is no way for it to come out because you're already backed up. So, but that being said, I've seen people do the big six and then it helps them poop. Now, you can also be constipated because you're dehydrated. So it goes that way too.
Right.
So that one you're going to have to play back and forth a little bit because pooping is a phase 3 detox that people go through. Phase 1 and 2 are for the liver, but just be aware of the uh, pooping thing
Okay.
as well.
Yeah.
Now, I also tell people that you don't have to have an issue to do the big six. I would like for you to do the big six to stay a hashtag beast mode monster, but just to be a resilient human being so you stay good. Right?
Yeah.
You can also, this is really cool. You can do this before you do an exercise or movement or training routine because I'm going to prime my fluid flow routes for movement.
Yes.
But when you slap yourself in these 6 areas, you're giving stimulation to what they call proprioceptors and mechanoreceptors around the biggest joints of the body that need good awareness when you move so you don't get hurt and you have better movement when you move.
Mm.
Basically, when you slap yourself, your brain knows where your joints are because you just slapped them.
Love that.
So you're going to be a better mover.
Yeah. Yeah.
And then that's the person who says, Doc, man, that's the craziest thing in the world. I ran like a damn gazelle. Like, and I hoisted that weight up off the floor like crazy. Well, I know you did, man. You had the blood flow. So do the big six, then you do your normal warm up.
Yeah. Is it, do you feel like there's probably a lot of people that maybe listening too that think, well, I feel like I probably have a great lymphatic system going on because I'm in the gym every day, and I look
Yeah.
and I look, I have a decent physique,
Yeah.
and muscle and all that. Do you feel like that's like sometimes just not necessarily the case? Like someone could be super active and still be struggling with their
Oh, I
lymphatics?
see it all the time.
Yeah. Yeah.
Yeah. Yeah. Because I see it in top end, high end athletes because one, they don't really look at their lymphatic system.
Right.
And they're very good at compensation and adaptation and resilience. So they can hide things without showing it where a normal person would have been falling apart long ago.
Yeah. Yeah.
So their thresholds are different.
True.
But one of the things that happens is when you're very muscular like that, you have a lot of tension in the body. Yeah, because you have muscles
Yeah.
and muscles get tight in order to move bones. That's what they do. But tight tissue doesn't allow fluids to move well
Mm. Yep. I know
because
that.
it's tight,
Yeah. Yeah.
right?
Absolutely.
So they can have blocks too that may be holding back some of their performance, but in their world, it's more about interfering with their recovery. They don't recover as well
Oh, yeah.
because the lymphatics are so backed up, but they don't present with the typical really swollen look.
Yeah.
But
Right.
I'm going to find it the same way. I'm
Right.
going to put you on the table. I'm going to push on the parts and see if you want to punch me in the face. There, I know. That's it.
Yeah.
Okay?
Yeah.
But you can also use this when we trace back to what we mentioned before, is that you do it before you train. And then when you exercise and when you train, you are on purpose doing something to actually destroy cells. You're breaking them down
Yeah.
because you can build newer ones and get bigger muscles, right? So you can become resilient through stress.
Yeah.
But I want you to think about that for a second. When you're breaking down all that stuff, what are you making? Waste.
Yeah.
Where's the waste got to go? Same place all the other waste got to go.
That's right.
So what you do now is you do your big six after your workout too.
Okay. Good to know.
Why? Because now you can get rid of the waste more optimally so you can go harder, faster, stronger, longer, and sooner next time.
Okay. Okay. Okay.
And so you're looking at the long-term results of the recovery as
Okay.
well.
Okay. So here comes a question for me. And I'm sure maybe, first of all, you guys, it's not just, I know Dr. Perry will agree, but it's not just athletics and movement to this nature. If you're having any kind of body work done, if you're going in for a massage, for me, I get fascial work done. It's really important that you do the big six before you go, because that way the stuff, there's like, your toilets are not clogged, right? So my question is then, should we be doing it after also, even the sauna, right? I do the big six before I get into the sauna.
Mhm.
Should I also be doing it after, or like after my fascial work?
Yeah, you first of all, it's a great point, and you are correct. You want to try to open up those drain pipes both ways before you have body work done.
Yeah. Yeah.
Because I teach everyday people how to do this stuff, and I also teach healthcare professionals how to do this, and massage therapists. And I say, you can go in and massage those spots for your client if you want, but better yet, why don't you empower them and teach them how to do the big six so that you don't need to do it for them,
Yeah.
and they can do the big six before they hop on your table really quick,
Yeah.
right? Because I want them to do the big six in between massages, you follow? Not just with the
Yeah.
massage.
Right. Right.
But yeah, you absolutely can. And then that's when you have to monitor again how you feel.
Yeah. Good point.
Did you earn the right to get there yet? So let's
Mm.
say this happens. You do the big six before you did your training, before you did your sauna or whatever. And you're like, ah, this is awesome. I feel like an Avenger. This is great. And then the next time you do it, you do the big six before and you do it afterwards. And then you don't feel so good. What does that tell you? You're not ready for two yet.
Yeah.
You have to stay with one. And then here comes the question. How long? Yes.
Play it by ear. Yeah.
I don't know.
Yeah. Yeah.
But then you can end up doing the two and then you're monster mode.
Yeah.
You're good.
The first time I attempted the big six, I felt like I had the flu for
Yep.
probably like 36 hours, and I knew what was going on. So it wasn't like I mean, not that I'm extremely worried if I were to get something like that anyway. It's just
Mhm.
it's just the body producing symptoms, right? At the end of the day, that's what the quote unquote flu is anyway. But that's how I felt, and I just knew it was happening. I knew it was happening, and I am very maybe to a fault sometimes, like I'm very much paying attention to my body and like perceiving it and everything. So I
Yep.
think it's important. I mean, not to be over analytical and like every little thing, but I definitely noticed too that I could be great with the big six one week, and then a month later, say in a random week, I could be doing it again, and I don't feel so great the next
Mhm.
day, or I don't feel so hot, in a few hours, or I have symptoms. So it's important, I think, to note too, at least for me on a personal level, that sometimes it just depends on where you're at in your life.
Yes, because your body is not the same this minute that it is in the next minute,
Yeah,
much less the
exactly.
next week.
Exactly.
So your nervous system and your immune system are always responding to its environment inside and outside, and your tolerance levels and your stress levels are different, and things can change.
Yeah.
But the important thing, and I'm glad you brought it up, is that these things become easier to go through when you know they may be coming,
Yes.
when you can expect them. It's just being blindsided by it that's really terrifying, because people that I usually see have been through so much that they're kind of scared of everything. But if you can prepare them for it, then it's usually not so bad to go
Yeah.
through it, to know that that's normal. But I want to cycle back on that too, is that, see, people say, I got flu like symptoms from doing the big six. So what does that tell you? That the big six is not some silly little thing, that when you first look at it and you see rubbing and slapping, some people dismiss it or they laugh because they don't understand all of what I just spent these 2 hours telling you. So now that you know that, you should be saying to yourself, but it makes complete sense of why I might get a flu from that, because of how much of the physiology of the body and the nervous system I impacted with something that looks silly.
Yeah.
It's not.
No.
And then that's why I always tell you that, when you get these things in the right places, but even more important than the right places is the right order of the places. That's the big takeaway. If you get that right, then you get results that are just mind blowing, because that's how physiology works. Physiology is what they call non-linear. I'm going back to kind of physics again. Linear is how we like to look at things, that if I do a stimulus at A, I get the same stimulus over here at B, like a straight line. You know, body doesn't work like that.
No.
You can have a small stimulus at point A, and it's not a straight line going sideways. It goes straight up. Like it's a huge difference in the B output. You're like, holy cow, man, what in the world just happened there? That's nonlinear. That's what that means. But it can also go the other way. You can do a really, really a ton of stuff and get nothing.
Mm. Yeah.
And the reason that is because you're in the wrong spot. That's what that's telling you. But that's why the big six has this huge out correlation to the effort that you put in the front end. That makes sense?
It makes perfect sense. Perfect
I
sense.
just want people to start and then
Yeah.
experience it. You will usually likely notice some changes within the first 1 to 3
Mm.
sessions.
Mm-hmm.
Sometimes it takes more depending on the person. Okay? But here's also something that's important to know. This is just one thing you can do to lymphatics. It's actually the beginning thing that
Yeah.
you
The
should do.
basics. The basics.
Sometimes the big six is not enough. You have to do other things. The blocks are too deep to get with the six. And that just means you need to have other skill sets that you don't know beyond the six yet. But you need to start with the six, because that's like me trying to get you to read Shakespeare when you don't even know how to read Sesame Street yet. You have to work your way to the more complicated things, because here's what you learn. The complicated things don't work if you don't know the basics and fundamentals first.
Right. Yeah.
They never work
No. You have to
because you
crawl.
skipped steps.
Yep. Yep. Yeah. It's and that's not to discourage people, I mean, I can honestly say that I'm probably one of those people that is on my way to doing things that are a little bit deeper because of the complexity of the issue that I have been
Yeah.
healing from, right? But you guys, even though that might be the case with me, what he's saying is so true because I have seen so much improvement, not just from a mobility standpoint and from a pain standpoint, but also just from a health standpoint. I will give you a primary example, but as we kind of start to tie this show up a bit, is that I remember, and this still happens, from time to time, but I remember just not sweating. I was like a non-sweater. I would get into my sauna bag. I'd sit there for 45 minutes and be like, what's happening?
Mm,
So not only did I have to change the way that I was hydrating, but when I started to do the big six, I was opening up pathways, and that was making a huge difference in the way that I was able to actually clear stuff out.
right.
So these steps, they're small, but they're monumental to your point. And yeah, I mean, maybe someone has to go, down the quote unquote lymph rabbit hole a little bit, or learn more in depth, or go through maybe a course or something like that. But you got to start somewhere. And like I said earlier, you got to crawl
Yeah,
before you walk. Yeah.
exactly. Well,
Yeah.
like I said, you're going to start with a big six regardless,
Regardless.
because it's going to help you in in some way.
Yeah.
How much, I don't know, but it's like the classic quote or whatever it is, a journey of 1,000 steps begins with one step,
One. Yeah.
you know. It reminds me of a quote that I got from a very good friend of mine. His name is Dr. Bo Lotto,
Hmm.
mad genius on neuroscientist. And we talk about how we want to change, go from one place to another spot. He said, when you're trying to move from spot A, which is where somebody is right now with whatever it is, maybe your pain or your discomfort, and you want to get to B, whatever that might be, whatever your goal is. The goal is not to go straight to B. You don't have to go straight to B, because that can be quite terrifying. The goal is not A.
Yeah.
What does that mean? It means do something different than you did yesterday, just not A. And then what you'll likely find is that maybe you're going to get closer to B, but as long as you're off A, maybe your journey was never supposed to go to B in the first place. Maybe
Mm.
you're going to end up at C.
Yeah.
But that takes a lot of pressure off you to have just not A.
Yeah. Well said.
So if yesterday was your A and you didn't do the big six, guess what? Today is your not A. Today I'm going to do big six
Yeah.
and see how I feel.
I love that. I love that. And it's and
Yeah,
it's it's not intimidating. I think that's the best part about it, is that it's just so simple. It's so simple, but it's so effective. And I'm not just, I'm not blowing smoke when I say that. I mean, it's honestly just so simple, and it's
right.
tangible results. You are seeing a tangible difference. No matter who you are, I feel like no matter what symptom you have, if you've got a symptom or 10 or 20, you have to work on your lymph. I mean, that's just it.
Well, you know what I've learned over the years is that when somebody's really suffering from chronic pain or chronic disease, somebody's overlooked a simple somewhere,
Mm,
a basic and a fundamental somewhere. And I see it all the time is that lymph is a simple and a basic, even though people are overcomplicate the hell out of it.
yeah.
Um, Drinking more water is a simple. Going outside and grounding on the earth is a simple.
Mm,
Moving yourself more is a simple. Surrounding yourself with people in your life that lift you up and they don't pull you into the sinkhole is simple.
yeah.
But those things, when everything comes down to those in the end, like you got all these courses, you got all these things, everything's going to cycle back to the same five things all the damn time,
Yeah.
every time. It's just like we don't want to see it or something, and we keep looking for all these magical things that don't exist, because the magic things aren't going to stick if you miss the first five. I just want you now to add the big six to your list.
Yeah. Yeah.
Like if you hydrate every day, you go outside in the sun and you ground every day, you do a little bit of breathing, right? And you surround yourself with awesome people, right? Uh, I just tell people, well, why don't you breathe and ground yourself and then slap the big six outside when you do it?
Hmm. Yep.
And
Yep.
maybe do the big six with another person in your life that gets it.
Yeah.
And I guarantee you what's going to happen is both of you are going to be smiling when you do the six. It happens. People send me videos all the time of big groups of people doing the six together and they're smiling and they're laughing. And then I have trainers that teach a huge group class, the big six, before they do their workout. I mean, it's just spreads
Yeah.
because everybody tells them the same things. Whoa, that felt great,
Yeah.
right?
Yeah. Yeah.
And I teach a course over 2 days. It's 16 hours on the lymphatic system. Like if you think I melted your brain here, I'm just touching the surface.
This is true.
But I can give you a biological and a physiological and a physics reason why those six things that you just did are so powerful. And you'll go, I get it. That makes sense.
Yeah.
Just
Yeah.
doing it now. Now everybody should be a little bit excited, a little bit hyped up
I hope
to
so.
do this. Well, I should hope so.
I should hope
Because
so,
if you're
especially
not, you're
after
going to
all
be missing
this.
out.
Yeah. And well, the beauty of everything that you just said about say these five fundamentals or six fundamentals, let's just say they're free, Dr. Perry. They're free. They don't cost you a dime, right? To go outside and sit in the fresh air. You don't even have to, the sun doesn't even have to be out. You could just sit outside in the natural light. If you just put your feet on the grass, if you talk to a friend that's uplifting, if you do the big six and it takes 85 or 90 seconds, if you do a little bit of breathing or just sit and stay off your phone for 5 minutes, those are all free, you guys. We talk so much about how, oh, being healthy is so hard. Well, we like to skip all of, the fundamentals and we just jump to the fancy. Let's not. Let's stay with the fundamentals, right? First, let's get those down. And so that's the beauty of it is every single thing you mentioned costs nothing except time
Well,
and not much.
well said. And thank you so much for stacking on top of what I said before because it's so true. And I've been around martial arts for a long time. Started training when I was younger. And one of my all-time favorite movies is The Karate Kid, the original one, right? But anybody listening who's seen martial arts or seen that movie or taken martial arts, first of all, you always learn that you have to master the basics and the fundamentals. Repetition, repetition, repetition. And you always practice your fundamentals in karate. They may call them katas, but in whatever sport it is, your moves. And then once you prove you master them, you can go to the next level. But you have to keep practicing your prior levels in order to be able to continue to get to the next one. You can't just forget them,
Yeah.
okay? Because you're not going to reach the next level. And everybody is like, oh, man, that's so boring. Why can't you just show me how to do a spinning back kick like in the movie? No, because first of all, if you try to, you're going to get your butt kicked, okay? Because you're always going to lose to a person who knows the basics and the fundamentals more. But the Karate Kid is a great lesson because it was all about wax on, wax off, sand the floor, paint the fence.
Yep.
Really? And, at the end, he doesn't get it. But all of that repetition, repetition, it gets into the nervous system. It gets in and it builds up. And then when Mr. Miyagi came out, he was like, bam, 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 bam. And he's like this. What? That's what it's like. You just don't see it because, it's like, can't you give me something else to do? No. And it's the basis of every single life lesson, hero's journey movie you've ever seen, of where the cocky kid has to realize that it comes down to the basics and the fundamentals. And this is where I'm kind of bringing it home. You talk about stories. Everybody's got a story. Okay? And the story is different. So everybody's story is different. So your healing journey needs to be different. But the story is all about the hero's journey. And the hero's journey is all about coming from what? Suffering and being lost and getting beaten down, but finding your way and having people that build you up and learning what doesn't work and what does work. And then that's the fight. And then you come through in the end. That's what makes it exciting. Otherwise, it's a boring story.
Right.
But that's what this journey is for people that are listening and have been through things, because you're never going to change and evolve and become stronger through comfort. It doesn't happen.
Nope. Never will.
You're going to perish faster. It's that stress, it's that hits you, that builds up the resilience.
Yeah.
And what I'm trying to tell you is this, is that's the story that you need to be telling yourself about your own story.
Yes.
Because if you
Yes.
don't, and you stay in the quicksand, that's going to cause your body to have all of this excess tension and all of this stuff. And you're going to feed, as Jordan Peterson says, you got a baby dragon in the cave and you're going to feed it. And then next thing you know, it's going to be a big one.
Yep.
And then you won't be able to control it.
Yeah. Been there. Absolutely. I'm sure a lot of people listening understand and relate a lot. Yeah.
Well, here's the thing that's really cool, man. It's really hard to tell yourself a story when you have inflammation and you're tired and you're fatigued and you're lethargic and you got brain inflammation because your brain cells don't work that well.
Yeah.
Well, guess what? If you do the big six, you're going to drain your brain, have less information, and your neurons can wire and fire better so you can tell yourself a better story.
Wow. That's a
How about
great
that?
point. Yeah. Yeah. That should invigorate the minds that are listening right there. It's true. It's true. I speak from experience. I mean, and I'm still in it. I'm literally still in it. I would be crazy and lying to you and to the listeners if I said that I wasn't still sort of in, the thick of things. But, you touch on a point I often touch on here, which is there is no resiliency does not develop without struggle and trial. And it is really important to remember that the words and the stories that we tell ourselves have such an influential part in our healing process. Because as you said earlier, as I touched on, nothing is isolated, and it's so much of our self-talk and the things that we tell ourselves, it's just so important. So we need to start telling ourselves a different story. And the mind and the body are so connected. They're more than connected. It's like one big machine operating.
Yep.
And so I
They come
love,
with a
love,
set.
love how you touched on this. I
Well,
love it.
words change physiology and biology.
Yes.
So you
Yes.
better choose wisely the words that you say to yourself, but also the ones that you think.
Yeah. Yeah.
Okay.
Absolutely.
But the one thing that I tell people too is this, is that I've really began to study recently the power of language and words and your ability to heal or not heal. Because I'm going to tell you right now, if you don't get them right, you're not. Um, is that words have power, like the words right or wrong. Okay, doing the limp right, doing the limp wrong. Just different.
Mm.
So what I tell people is this: is I no longer use the word cure for anything. I'm going to tell you why. Because this subconscious, unconscious takeaway from cure is it's gone. And it's going to stay gone. Nope. It's management. So you either manage to have pain or you don't have pain.
Yeah.
You either manage to be sick or you don't have sick. It doesn't just stop. Okay. So cure is a dangerous word. And I learned that in medicine too, because you can't throw that word around.
Yeah.
Cure. And that may seem trivial to people that are listening, but I assure you it's not. And I like the word management for one reason. It's your responsibility.
Mm. Yes.
You have to put the work in. You have to lift your end of the couch, which means you gotta do the work. You got to chop the wood. You got to carry the water. You got to show up. It's just knowing what that is and then not being too overwhelmed with the sheer volume of it. So that's why you start not A and you start slow and you work your way there. And you come to understand what I'm saying is true the longer and the more you've been in the darkness.
Yes. I could say a big amen to that. Yeah, absolutely.
And I
Oh my
know because I've
goodness.
been there.
Yeah, you have. You have, I mean, goodness. But if you were not there, we wouldn't be having this conversation, you know? And that's, it's, it's comes full circle. And we are often just most of the time we can't see the forest through the trees when we're in it. Again, I say this all the time and I feel like I'm a broken record here, but we can't see what's ahead. But the only way out of the situation that you're in is through it, and you've got to go through it. And a lot of times there's just
Mm.
some things super magical on the other side of that. But you have to do quote unquote do the process to get to that, and
Yep.
you're an absolute prime example of that. And I can't tell you just how much I think your work is not just impactful, but it's thought provoking, because again, you're
Mm.
changing the way that people think. And I
Yep.
really, really appreciate that. I wanted to tell you as we wrap up
Mm.
that I had asked. I know I realize that we're we've gone a while, and I don't care. I mean, shoot, I could talk another 4 hours, but seriously, there's so many questions. But I don't want to overwhelm our listeners, but I do want to say that I had asked my followers on Instagram, and they sent in
Questions?
some questions, and
Oh,
I know that I
cool.
probably can't get to all of them, but maybe I'll ask you two of them.
I love questions
Okay.
because the reason I love them is because it helps me think,
Yeah.
but
Yeah.
it also helps me become a better teacher because then I know if people are actually getting what's in my head into their head.
Right. No, and I think no, I love that. And I feel like this one is probably a pretty common one, but
All right.
and you had mentioned the removal of lymph nodes
Yeah.
before. So I wanted to make sure that I got to this one, which is what are your thoughts on lymph node removal? And if someone were to have that, say for example, under the armpit, like say they had a mastectomy or a double mastectomy. In this case, this listener did have that.
Hmm.
What are your thoughts, and like what happens with the compensation there? Would they still be able to do the big six and so forth? Like, how do they work around that?
That's a great question. Okay. And that's a really great question because it's very common for people to need to have lymph nodes removed for many reasons. And that is necessary sometimes, right? I mean, you have to do what you have to do. I needed to do that with mine, right? Because sometimes you got to, save your life or prevent something from spreading, and then you just deal with it afterwards. Okay? But nothing changes in relationship to where a fluid wants to go. It's just can it get there or not?
Okay.
So if you have, let's just say things removed around the axillary breast tissue region here, you have less of something you need and you have scar tissue. Scar tissue changes routes of fluid. But so they're automatically going to be congested because of the scar tissue and overloaded because you're missing some.
Hmm. Okay.
So you're automatically going to be prone to inflammation. That's one of the reasons why I encourage people to actually even look for and consult with a lymphatic massage specialist if you've had surgical removal of things, because you need to go a step further. Okay? But fluids, like in nature, you can't hold the power of fluids back. They're going to try to find their way out somewhere. That's what water does. That's what leaks are, right? So if you had some lymph nodes removed in one area, it's going to try to send it to another cluster somewhere else.
Mm.
It's going to actually bypass things and make different routes. It's not going to form new lymph nodes, but it'll try to form new tributaries or pathways. So, for instance, if you had something removed from your right pectoral, it's going to try to send it to your left.
Gotcha.
That's why you need to make sure that you always treat both sides, because you need to open the side that can take something from somewhere else. And you usually will end up clearing the center line in that case around the sternum because
Okay.
it has to pass the sternum, which is not in the big six. But it will also take the lymph from the right side and it can send it down towards the hip
Mm. Okay.
because it's going to say, let me send it down here, then it can go up.
Okay.
Okay. The more superficial ones like this. That's also a reason why I don't want you to isolate lymphatics.
Mm.
So if you do the big six, guess what you just did? You opened up all the flow routes to take anything from anywhere.
Gotcha. Okay. Okay.
So it's much easier for it to find its way out because you didn't fall into the trap of lymph is backed up in my right arm. No, lymph is backed up everywhere.
Mm. Got it. Okay.
One piece, right?
Okay. Yeah.
That
Okay.
makes sense?
Yeah, it makes perfect sense. And that would make it makes sense as to why someone would see, like, say, lymphedema in that particular area, but that's not necessarily the only area that needs attention. It's everywhere else.
Right. And then here's what I tell people is listen, you can have a surgery done or you can have a trauma done, but what was the state of your lymphatic system before you had your surgery or before your injury?
Yeah.
I'm going to contend that it's probably overwhelmed and not working well before you got hurt. And now you're going to stack on the trauma and the surgery on top of a system that was a mess that you didn't even know was a mess. And that's why you're not getting better because you just assumed everything was great before you had an injury or a surgery. No, doesn't mean that at all. So that's why your prior habits and behaviors and keeping up with the big six matters because what you're going to find out is when you do get an injury or you do have a surgery, you're going to recover like a hashtag boss. You're going to be like, whoa. Even your doctor's going to be that way. I have people who get surgeries and I say, do your lymph before you have your surgery and do your lymph after your surgery. And your surgeon's going to say, what in the world are you doing? Because you healed faster than anybody I've ever seen. And I know it because the same thing happened to me.
Mm. Okay. Okay. Yeah. No,
Now
this
you
is
know
good.
why.
Yeah, this is good. This is good. I know people are listening that have questions about that, about the, just I
You
feel like
have to
some
go a little more delicate with that. So, the big
okay.
six is designed more for people that don't have a lot of compromise in
Right.
a region. You can
Right.
still do the six,
Okay.
but you would probably be a little bit more gentle and easy around an area that's compromised because that just makes common sense.
Right. That's logical.
But you're also going to have to take a little bit more time and care in trying to help the stuff move out. So in that case, once I cleared the big six, I may then go back to the compromised area and spend a lot more isolated time there
Okay. Okay.
because it needs a little more hand holding because it's been compromised. You follow?
Yeah, logical. Yeah.
But I don't want you to forget that you can't just love this guy and forget all the other ones either.
Yeah. Okay. All right. All right. No, that covers it. That was good because I feel like that's important too. I feel like a lot of people have that question, and I see it too. I've seen it on social media. I've seen people ask you in the comments and stuff like that. I see that a lot. So
Yeah, the thing is, it's difficult sometimes for me to answer a lot of questions on social media because of the story factor.
right,
Like
personalization.
the no two people are the same in
Right.
relationship to how I might have to handle something for that individual. What does stay the same is how fluids move. That doesn't change. That's just that's like physics and the laws of the universe. That doesn't change.
Yeah.
How some of the things that you have to do depending on the individual around those laws has to change a little bit. Like what we told you before, a little bit more time.
Yeah.
But
Gentle.
I know where stuff wants to go. As long as you know that, I can figure anything in. That's my crystal ball. I know where it's going. or I know where it wants to go. And
Right.
my question is, can it get there or not?
Got it. Got it. This is an interesting one.
Ah, okay, good. I like those.
Ready? Yeah.
Yeah.
How does laser hair removal impact lymph? And if it does, how to get around that or not? I mean, is it something that would have an impact on the way that your lymphatic fluid is moving?
So first of all, I'll be all honest, I don't know enough about that procedure to give you an educated answer about what it does to the lymphatic system. So I would be speaking from a place of just sheer ignorance there.
Okay.
But uh, everything that you do impacts the lymphatic system, but it doesn't mean that just because you impact the lymphatic system that it's going to fall apart either.
Got it.
It's a very resilient system, and you
Yeah.
are a very resilient human, and it figures stuff out. I get that question about tattoos a lot. Like, I'm loaded with them, and tattoos are going to impact the superficial lymphatics for sure,
Mhm.
because it's a needle, and every single one of these is a scar, and
Right.
you're bleeding ink into your lymph 24/7 the rest of your life. So it's in your lymphatic system. What it's doing to the lymphatic system, we're starting to take a look at that it's actually there. But what it does, we don't know, because there's a lot of variables into things like how crappy is the ink that you had used on you, kind of stuff. Right.
Yeah.
All those and locations and stuff like that. The more that we are looking at lymphatics now and maybe have even the technology to be able to see what's happening, then we can tell you. But either way, to me, it doesn't matter. I'm going to make sure that my big six and my lymph works as best it can, no matter what
Right.
I
Right.
throw at it.
Okay.
Now I want you to do big six before what? Your laser hair removal.
Yes. And probably after, right?
That would be a good idea.
Yeah. Yeah. Okay. Okay. That makes sense. That makes sense. What about Botox?
Oh, I get that one a ton too. And
I bet. I bet.
I'm gonna come from the same thing,
Okay.
that I don't know enough about Botox in general.
Hmm.
I'm still gonna come from the same fundamental principle of, when you do anything into this region, you're gonna impact how fluids move. And the stuff, everything that you inject in your face is gonna change fluid flow routes. And that's what I'm going to ask somebody. All I need you to know from me is tell me, where does the face drain? And you should be pointing to spot number one at your collarbone.
Yeah. Yeah.
So I would open up those spots. Definitely one, definitely two. And you can do more now that if you go deeper into some stuff of understanding the lymph around the face. But those are the first places that you start.
Okay. Last question for you. We'll cut it here. Do you feel like this is important for children as well, or do you feel like children suffer a lot less because they move a lot more?
So, yes, I get this question a lot. They say, Doc, can I do this on my kids? And can I do it if they're this age? Yes, because they're human beings too, and they have lymphatic systems. Just because they're young doesn't mean they're not overloaded with toxins. Because
Okay.
you have babies that are born with toxins inside their system because they find them in the placenta.
Right. Right.
So they're overloaded with it. And so as soon as you are inside your mom, you get toxins. You come out into the world, they start coming on in. And you just may not notice things then and there because you're young and you're resilient and you can just do things and then everything's great until it's not.
Right.
And when you want to understand anything about the body, you know that the nervous system and the immune system never ever forget anything, even though you do. That's my joke because you'll forget it, but your subconscious and your unconscious never forget it,
Mm-mm.
and they're always there. Okay? And then that's the person who is 20 years old and they have all this stuff going on, and you have to go all the way back to when they were a zygote. Like you got to go all the way back and gather a history because all that stuff matters. And I would say, I tell people, you can do the big six to your kids. I have moms that send me videos of them doing the big six on the babies, but they just use their finger and they rub, but they don't tap, but they rub. And you see the look on those babies' faces because they just friggin' love it.
Oh, I love that.
And it's just like rub time and tummy time and
Yeah.
everything. And I think they love it because the nervous system's going like, all right, my mom gets it. She knows. Like, this is good stuff.
Yeah. Oh, I love
Right?
that. I love
Yeah,
that.
yeah, yeah. So
Very
you
cool.
just get in there and you start as soon as you can, right?
Yeah. Okay.
And then I list some contraindications of instances where you might not want to do big six on my big six pages because
Mm-hmm.
there's a few of them.
Mm-hmm.
I usually don't get into them on these episodes here
Mm-hmm.
because there's a lot of variables to it where it's some are absolutes and some are kind of gray areas. Um, so you can probably the best way to find out about contraindications on lymphatics, honestly, is just type into Google lymphatic massage contraindications and it'll show up.
Oh, good. Okay. Okay. That's good advice. Yeah.
there's,
Yeah.
there's like a big sliding scale there
Yeah.
of individuals because
Okay.
that would take me down a rabbit hole for an hour.
Right. Yeah. It's a whole, and it's not a simple answer. Essentially, it's not a
No,
simple answer.
no,
Yeah.
I mean there's some hard line no's on
Mm-hmm.
things,
Mm-hmm.
but it's a wide range. So start there and
Okay.
then see the big six on our website and stuff, and we'll go over the bigger ones for you.
Well, you just led me to my next question, which was how can people find more about you, more about your work, your resources, the courses that you offer, and so forth? Obviously, your website, but tell us a little bit about where people can find more because I know that they're going to want to if they don't know you
Uh,
already.
well, I certainly hope so. And first of all, I want to thank you. I had a great time. We hit what they call the flow state.
We did. We
Just time
did.
just like
We
hit by go
did.
that
I
fast. And I
know.
hope I hope that people that, are listening or watching had some fun and enjoy it, but also learn some things and also maybe have a little bit more hope because hope's not a bad thing. But it's pretty easy to find my work because I've been doing this for a long time. You can just type in "stop chasing pain" and stuff's gonna come at you a lot. And website is the main thing, and that'll branch you off to all the other platforms. And maybe you have a preferred platform that you like to learn on. I'm on most of them as well. If you just type in the words big six, big and the number six, I'm gonna pop up
Yep.
because it's around, been around, it's making its way around. And then I'm currently I'm in the middle of finishing up my book where I'm gonna take this thinking process that I've been talking about and put it out there for everybody to have for themselves.
Amazing.
So then they can have even more resources to go through. That'll be who knows when that's gonna launch. I got to finish it first, but
Well, you already
that's
have
the
one customer because I'll be picking up your book. That is for
uh
sure. That is for
thank
sure.
you. I
No,
appreciate that.
absolutely. And you know what, you guys, I just, if you're on social media and you don't follow Dr. Perry and Stop Chasing Pain, I know he's really active on social media, but particularly Instagram. Wouldn't you say like that's where you love to share a
That's by
lot?
far my favorite.
Yeah.
I just like the platform and I like the energy of it
Yeah. Yeah.
from
Yeah.
there.
Yeah.
I spend there, and I've recently I've been on YouTube for many, many years, but I kind of drifted away from it while the pandemic was going on.
Mhm.
And I recently got back into posting on YouTube, which is Stop Chasing Pain a lot more. I'm enjoying that quite a lot.
Okay.
So Stop Chasing Pain on YouTube and Instagram are
Your
the
two
top two
primaries.
places to
Yeah.
find my stuff for sure.
Okay, cool. Well, I would just highly recommend following him. You guys, I cannot tell you this is not an exaggeration. If I were to go through my saved posts, your face is plastered all over my
Oh
because
man.
I save so many of your videos and I go
Hopefully
back
my
to
still
them.
shots were
No,
halfway.
I don't even know. Yo, I'm the worst with that, by the way. Like
Oh,
I'm the worst with still shots and candid photos. But no, seriously, I have so many of your videos saved, and I pass them and I share them too. I mean, I think that's how we've spoken before we actually met. Today is because
mm,
sometimes I'll put something on my story so that people can see it because they're just like the best tips. You share so many things for free, my friends. He is always sharing
yeah.
things and little 5-second things you can do or 1 minute things that you can do depending different body parts, etc. So his content is super valuable, and I do not just say that. So if you are on social media, especially Instagram, and again, like he said, YouTube, make sure that you find him. I think that you will get a lot out of it. And as always, I will put all of this, all of the references that Dr. Perry has mentioned, I will put it in the show notes as well, so you can find it all there. I do not even know what to say or where to start with my gratitude for you. And
Ah,
I will honestly and I told you this off air. I just envisioned a day where I got a chance to sit across and talk to you personally and be able to share all of the wisdom that you have with the people that listen to this show. And so for me, this has been such a beautiful few hours. I am so grateful to you, and I just feel like it's an honor to be in your presence and to just soak this all up. From the bottom of my heart, thank you so much.
oh my God. Well, that you're gonna make me tear up over here. So
Oh,
thank you very much. That was really wonderful and very kind.
I mean it. Every single word. I mean it. So, one day maybe I would love to have you back. We can get into some deeper detail about things. But in the interim, I cannot wait to share this with our friends. I thank you again, and I hope you have a beautiful day.
Thank you very much. You too, and everyone listening. Thank you.